Hi, everybody. It's Brendan again. So we're going to cover two topics in this. We're going to cover intranasal and intramuscular. So the two different routes, and we're going to combine them in one PowerPoint for you guys. All right, so here we go. So IM injections, breaking obviously that acronym down, IM into intramuscular. So again, breaking that word down into just saying that it means into the muscle. That's what we're doing when we give an injection via IM, into the muscle. We're giving an injection into the muscle. On the right hand side, I just wanted to put the layers of the skin. So kind of quickly reviewing that, that you have the three main layers of your skin. So the epidermis, the dermis, and subcutaneous layer, right? So as we get deeper, you're going to have more fat, right? So the bottom layer, more fat, connective tissue, larger blood vessels, where, in the middle that you have the dermis that contains your nerve endings, your oil and sweat glands, and some hair follicles. And then your epidermis, which contains cells that produce that pigment on your skin and protects the immune system because it gives us a barrier from the outside world, from God knows what is out there. So the injection through the dermis and the subcutaneous layer into the muscle layer, right? So that's what we're planning to do. We want to do an injection through the dermis and the subcutaneous tissue into the muscle layer. Absorption rates when we give a medication through an IM injection is absorbed pretty actually quickly due to the muscles being highly vascular. Obviously, IV is one of the quickest routes. IM is very quick as well, just because our muscles are highly vascular. So we can normally give up to 5 mLs the IM method, so the IM route. But I wanted to break it down a little bit more and explain that you usually can give up to 2 mLs per deltoid, and then usually 5 mLs per anterior lateral thigh, which is the preferred site. Granted, you've probably been on a call where maybe a medic or maybe yourself, you've given a medication to the deltoid. We really want to aim towards giving a medication to the anterior lateral thigh. Why? Because you can give more. You can give up to 3 mLs more for that one thigh rather than a deltoid where you can only give 2. And so that is going to help for if you need to give multiple doses. So like epinephrine, great example of, epinephrine 1 to 1,000, I should say, is a great example of why we should use anterior lateral thigh. Why? Because if you need to give them multiple doses of, the 0.3 or the 0.15, then you can, and you can use just one thigh for that. Granted, they probably won't like it, but but you can give up way more than just the 2 mLs in a deltoid. So. And then just realize also that there is potential for nerve damage due to the depth of your injection. So how deep you're actually going. But use the appropriate site. There's circumstances where you might have to go to the deltoid, and that's understandable. All right, so we have the IM injection sites now. So on the left-hand side, I just wanted to put up some pictures to show you all the different sites that we potentially could use for IM injections. Granted, the vast majority of us, and almost I can say all of us, would probably give the most attention to either the deltoid or the anterior lateral thigh. So we're going to usually use the anterior lateral thigh or the deltoid, which in this case would be, in the what are the muscles on the side? So we have two right there, the large muscle on the lateral side and the muscle on the anterior side of the thigh. So we don't want to go directly on the full-on anterior, so we don't want to go right where their femur is, but we're going to go close to the anterior lateral, so kind of in between those two spaces, not full-on lateral, not full-on anterior, but kind of just right in the middle between there. There is that, your glutes, you have your glutes, the buttocks, but we're not going to be giving IM injections there. So I wanted to cover the two different styles that we potentially will see medication in, and I want every everybody to be comfortable in how to use them. Granted, a lot of us are very familiar with vials, and not a lot of attention gets into ampules. And granted, a lot of people are right. You probably won't see them a whole lot, but we do still carry it on our trucks, and some hospitals do still carry it. And so there really shouldn't be an excuse or reason as to why you can't draw up from an ampule. You should have learned it in class. We definitely will refresh everyone's mind when we do skills, but I think it's a great time to review it so that way everyone feels comfortable with it. So that way, if we do carry it in our trucks, you know how to use it and you can give it effectively, especially for medications like epinephrine 1000, where we're going to be giving it to a patient in anaphylaxis when they need it. We don't want the excuse to be, oh, well, I didn't know how to do it. That doesn't really sound great. So as far as drawing up from the ampule, you want to go through your 6 rights. You want to gently thump or tap the stem of the ampule, shake that medication down to the base of it. You want to grip the neck portion, which is at the top over here. If I can do that, hopefully you can see that. So the neck up there, and you want to kind of grab, the neck portion, and there's this little white line that should be there, and or these 2 white lines, and you should kind of break it around that area. And you can either take a gauze pad, just, like a little 2x2, maybe 4x4, if you got it handy, or even an alcohol prep pad, and just the way it's packaged. Don't open up the package. That's a little Andrew Mason tip, and you just take that and snap the neck portion off. You don't need a whole lot of force, but you definitely need enough force to snap it off. You want to be careful because, now that portion is glass, and so you don't want to cut yourself. So you want to touch that outer sides, but you want to insert a filter needle, and that's going to be key, is a filtered needle into this medication. Why? Because you just snapped off something that's glass. So you don't want to draw up portions of that medication that might actually have tiny little glass shards in it, right? So we don't want to be giving that to anybody. So that filter is going to filter it out. And then you want to hold the syringe with the needle pointing up. You're going to press on the plunger to expel any air bubbles, and then you're going to recap it with a one-handed technique. And then you would throw away that filter needle, choose the needle size and gauge of your choice that's appropriate, and then give the medication to the patient. So vials, so we're all a lot more comfortable with vials from what I can understand and see out there. So ampules are really a hit home, but I still want to go over vials and make sure everyone's comfortable with that as well. So steps for drawing up, again, you're going to go through your 6 rights. You're going to determine how much, the medication you're going to need. You're going to draw that amount of air into the syringe. In this case, you probably just want to use a blunt needle. Again, the big thing too, before you actually draw up any medication, I should add to that, you want to remove that cap. And you also want to make sure that that cap is there first and foremost. If that cap is not on that medication, it is no longer valid, because that now is possibly contaminated. It possibly got meddled with or tampered with, so you shouldn't trust it. I know somebody is like, oh, they might have accidentally just, maybe somebody accidentally popped it off. Well, it takes a little bit of effort to pop those things off. So better safe than sorry. Toss it in the sharps container and just grab another vial. So that, that's a big thing, even when you do med checks, is making sure that those caps are on there and they're sealed and they aren't tampered with. You can kind of twist it back and forth and make sure that it's secure without removing it. And then obviously when you do remove it, you want to clean the top portion of that vial with an alcohol prep pad in an aseptic fashion. But yeah, you want to choose your, just a regular blunt needle is going to work for this. You don't need a filtered needle, and you can draw up the air for the amount that you need, and then you can you can just basically poke there's different ways of doing it, but you can just take it flat, just like how you see in the picture. Take your syringe with your blunt and just poke it into the stopper, and then invert it at that point, and then you can push in the air slowly into the medication and then draw it back. And then of course you want to withdraw the needle. You want to expel any air bubbles from the syringe. We don't want that there. And then you want to recap that blunt, or put that into the sharps, and then again, you're going to choose your choice of needle based off of gauge and size. All right, so as far as the procedure for the IM injection, again, you want to go through your 6 rights, make sure you have that all patterned down. Find the appropriate site for the IM injection, clean that site with an alcohol prep pad and an aseptic technique. And this is where you want to stretch and pull the skin taut. You don't want to you don't want to squeeze, because if you squeeze the tissue, that's actually kind of going more sub-Q, then even though we're going at a 90-degree angle, it's a lot different than a lot different area that you're kind of manipulating that skin to be. So we just want to stretch the skin, pull it taut. We want to insert that needle at a 90-degree angle. We'll deliver the medication. And then afterwards, of course, you're going to put it into the sharps, and then you want to actually rub that area in a circular motion. That's going to kind of help put that medication into use, kind of start it up. You don't need to be, rigorous or anything like that. You don't need to go crazy about it, but maybe just a slight little rub in a circular motion. And of course, if they start to bleed, then you can do a gauze pad or a Band-Aid, something like that as well. And then, of course, you want to monitor the patient's condition. So some tips and tricks for IM injections. So needle sizes. Normally, we're going to be using a 19 gauge needle up to a 23 gauge needle. You want it to be around 1 to 2 inches for the needle. And then when you actually give the IM injection, you want approximately 90% of that needle to be used. For finding the deltoid landmark, you could do one of two things. You could do, approximately 2 finger widths distally from the top of the shoulder, and then find your site. Or you could do 3 to 4 fingers width, distally from the acromonian process. So we can do that as well. And hopefully those 2 pictures kind of roughly show it in the meantime prior to you guys coming in for skills. Intranasal. So we'll move on to intranasal. So this is our way of giving medications via the nasal mucosa. So it's pretty easy to give, and it's actually a pretty rapid way of also giving a medication. Granted, if you give it too quickly or you give too much volume, right, they might cough or swallow the medication. Granted, for what we're using it for in our circumstances, A's is going to be naloxone, so AKA Narcan. That might not be a huge issue, but you want to also take that into consideration. You want to avoid giving it if there's some foreign debris in the nares. A great example, when I was going through my medication review or getting signed off with Andrew, was actually talking about having the situation of, would you give IN Narcan to a patient when wouldn't you give IN Narcan to a patient? And I had to really think of a reason why, and I couldn't think of one until he had said, what if they actually snorted right, some narcotic or some type of opioid, right? So that is it's a great example, right? And they have some junk in their nostril. You think you're doing no harm's way by giving them an IN because it's pretty easy, like I said. But now you just made a slushy in their nose, and that's not going to help for ventilations. That's not going to help in general at all, and probably the medication that you just gave is not going to seep through to the nares. So that's a reason why we wouldn't want to give it. And you want to maybe give it other ways, like IV or IM. And it also might not be as effective, again, with nasal drug users. So if they're used to it that way, that might not be as effective. Doesn't mean it won't be effective at all. Just might mean that there is a chance or possibility that it might be not as effective. Some tips and tricks. So we want to use both nostrils when we give Narcan, right? So the big idea is that through our protocol, we're giving 1 ml max per nostril. That is the biggest thing to kind of take away from this. is that's how you're doing it. So, you have 2 mLs, you're going to give 1 per each nostril. And just remember to do that, not just 2 in 1 nostril. You're splitting it up. You also want to use the MAD, so the MAD device, which is onto the left-hand screen. So mucosal atomizer device or atomization device. That's what's going to help, basically help atomize it and make that spray you can see and that you give inside the nair that sometimes you can't see because you're giving it. But that's what you want to do, and you want to give a forceful push to actually make it atomize versus a soft push will actually make the medication just drip into the nose. And so these next 2 slides, I'm not going to really narrate too much, but I'll let you just watch the video and let it speak for itself. But one nice forceful push makes it atomize versus kind of a soft push and just kind of like just barely doing it is just going to kind of make the medication drip, and that's where we don't want. We want it to be a forceful push that atomizes it. So this is a good example of how to use the MAD device when you're giving Narcan. So I'm going to just play the video just to kind of have you see what I'm talking about. So one nice forceful push kind of makes it atomize and spray out, and that's what we're going for. And then now I'm going to show you a not so great example of how to do it. So this is a not so great example of how to use the MAD device, right? So we don't want it to kind of trickle out like, we're just finishing up washing the trucks and, you shut down the water and that's kind of what it looks like, right? So we don't want that, and it's super slow, the speed that we're giving it at. That's not what we want. That's it. There will be a short 10-question quiz after this based off of the information on the PowerPoint. And again, I look forward to the skills portion as well. And you only got 1 more video to go. All right, guys. See ya.